Many young men suffer from a painful disease called Bekterev's disease. Let's look at what else you can do about it besides conventional medicine. Bekterev's disease is also called Ankylosing Spondylitis. It is a painful rheumatic inflammatory disease of the spine, pelvis, and of the sacrum. It mainly affects young men. Most are between the ages of 15 and 30 when the disease begins. And the typical symptoms are deep back pain, low down to the sacrum area, and just constant pain. They can last all night. Some patients have to stand up, walk around a bit to get some relief. And it includes morning stiffness. It takes time to get up in the morning and be able to move. The cause is autoimmune. So again, we are in the topic of the immune system, and in conventional medicine, we say that the system is fighting against the patient's own tissue. But I see other factors as well, and we will look into this now. I would like to briefly draw what exactly happens with Bekterev's disease in the spine. Here we have a vertebral body. I'll draw two so you can see how this works. These are the spinous processes. Here, in between, these two vertebrae is the intervertebral disc, a soft material that allows the mobility of the spine. Now this is what happens with Bekterev's disease. I'll come back to what happens here in a moment. And then finally, something special happens. With Bekterev's disease, the inflammation takes place here. This is called the bottom plate of the vertebral body, and in the cover plate of the vertebral body. This is the place where an inflammatory disease takes place. If this continues for years, the disc will be damaged. And here I have drawn the final product. You see, this became very small. The intervertebral disc has somewhat ossified. The two vertebrae are close together, and this causes real pain. And that is where the immobility, or the lack of movement, comes from. And here, a quick drawing of what happens in the pelvis. This is the pelvic bone. Back there we have the sacrum. And then on top of it, the spine. And very specifically affected are the sacroiliac joints, which is this joint here, between the sacrum and the pelvic vault. These joints are inflamed along with the vertebrae in the previous drawing. And this inflammation in the joints triggers this constant pain. So that's what's going on with the ankylosing spondylitis. What can you do? Let's move on to therapy. Conventional medicine is very limited. They give these rheumatic painkillers like Voltaren, ibuprofen, and so on. And if you have to take them for a long time, PPIs are prescribed because these medicines attack the stomach lining. So these patients take multiple medications for years, painkillers and gastroprotective remedies. For very intense episodes of pain, cortisone can provide some relief. And as always with all autoimmune diseases, immunosuppression medication is also given. They are special, expensive drugs which suppress the immune system and thus already inhibit this inflammation. But in integrative medicine, we have additional possibilities. It's all about the immune system, which I prefer to strengthen rather than suppress. Therefore, always omega-3, vitamin D, magnesium and zinc. This gives us the foundation for a healthy, good immune system. And in nature there are many natural anti-inflammatory drugs that we can also use here. This includes chokeberry. These are berries that are very rich in anti-inflammatory nutrients. Chokeberry extract, for example, OPC from grape seeds, and other berries, reishi mushrooms, frankincense capsules, green tea, and so on. There are many natural anti-inflammatory substances available, you just have to know about them. And because we do not eat enough of these substances, these products are available in capsule form. Very importantly, Bekterev's disease patients should not eat pork because in pork we have the arachidonic acid, and this acid promotes this inflammation in the spine. A good diet with lots of natural substances, practically vegetarian in this case, greatly supports the healing process, because in all the vegetables, salads and fruits we have anti-inflammatory substances. You can use that. And as always, with all autoimmune diseases, I suggest a gut treatment to strengthen your digestion. I recommend you look at the link below to a website with a lot of information on how to heal your gut, because a sick gut and an autoimmune disease go hand in hand. Darm- und Autoimmunerkrankungen haben einen engen Zusammenhang.